All right, welcome everyone. We're just going to wait one more minute. We have one more. Oh, Michael's here. Great, all of our presenters are here. And I see we have several participants that have joined us. And so we want to be respectful of your time and attention. And so we'll go ahead and get started. First of all, I just want to welcome all of you to our webinar. We're trying out something new, trying to be able to be as transparent and proactive in answering your questions about our grant making as we shift over the course of these several months. I do just want to open by saying thank you to all of you. On behalf of the staff and board of the Hartford Foundation, we have just been floored by the incredible response from the nonprofit community to the crisis created by COVID-19, both the public health crisis and the economic crisis experienced by vulnerable populations in our community in particular. So we really are here in service of your efforts, and hopefully today we can give you a little more information on our response to help you. So today's webinar will be recorded. We will share both the recording and the slides with everybody that registered for the webinar, and these will also be available on our website to those that weren't able to attend. We will do a very short presentation just to share with you some information. If you could put your questions in the Q&A, when we stop at the end, we'll make sure to go back and address any questions that we weren't able to clarify through the presentation. So we will keep this brief. We're just going to do a short overview, and then we'll do questions at the end. Okay, so just to start, brief introductions. My name is Erika Frank. I'm a Senior Community Investments Officer here at the Hartford Foundation for Public Giving. I generally work on our community and economic development investments, including HFPG Impact, and have been really honored to co-lead with Amy Studwell, the Hartford Foundation's COVID-19 Response Fund. So with that, I'd like to just have our team briefly introduce themselves.
Hi, everybody. I'm Amy Studwell. I'm with the Nonprofit Support Program. I've interacted with a lot of you, and I'm happy to see so many on this webinar today. So typically, you'll see me at our NSP events and working specifically on financial management and technology. But as Erika said, I've also been very involved with our COVID fund, and I'm excited about our next phase of where we're going here.
Hi everybody, I'm Dawn Grant. I also am very excited by the overwhelming response to attending our webinar. This is the first webinar for me, so forgive me. I am a Senior Community Investments Officer, primarily focusing on basic human needs and homelessness.
And I should unmute myself first. I'm Michael Wotorson. I want to join my colleagues in thanking all of you for joining us this afternoon, and also for all the wonderful work that all of you are doing in the community. It's simply been outstanding against some very, very difficult circumstances, and I just want to call attention to that and say thank you. I am also a Senior Community Investments Officer here at the Foundation, and I primarily work on education, particularly supporting the Hartford Public School District, and I co-lead our work in community safety and reentry supports for individuals returning from incarceration. So thank you again.
Great. We will get started. We're just going to give you sort of an overview of where we've been over the last 3 months or so, the transition, which was announced last week, to our reopening fund, Amy will be able to go a little bit more in detail about the process and application and what you can expect. And then we'll turn it over to Michael and Dawn to talk about our other strategic priority work through the end of 2020. And then of course, open it up to your questions. So as you all are aware, when the pandemic became the urgent issue that it did, we launched our fund, and through the generosity of the donor community here in the Greater Hartford region, we were able to raise a little over $4 million to be able to re-grant out to nonprofits. In addition to that, we've added our own regular grant making funds, and over the last 3 months, we've awarded starting to get close to 8 million, and you'll see through 134 grants with an average grant size of 57,000. I'd say the probably biggest impact of the COVID response fund here internally has been a dramatic shift in our grant seeking and reporting processes and payments as well, which I think any of you that have applied through the original COVID response fund hopefully have experienced a streamlined application process. We are trying to keep the information we ask of you to a minimum, understanding the urgency of the crisis and that things are changing constantly. And so all you can share with us right now is what you know right now. In that same spirit, we really had to shift many processes to be able to approve and pay grants expediently. And if you haven't yet reported on a grant that was awarded, you'll see likewise a streamlined reporting process for those funds. And you know, I do think that these are things that we've been talking about at the Hartford Foundation for a long time and have made strides in the last few years, but this crisis really just jump-started these efforts incredibly. And so the framework for our last round of funding was really just short-term emergency support over a 3-month period. Obviously, the need for flexible dollars was critical as week by week, all of you were experiencing different circumstances as the crisis unfolded. We did make the decision early on, given the just sheer scope of the need, that we needed to prioritize our limited dollars. And so we did have a primary focus on basic human needs, particularly for the most vulnerable populations in our communities. So that included mostly food distribution, health and mental health, direct assistance, safety of congregate care settings, and facilitating distance learning at our lower income, lower performing school districts with high needs. So we also were able to, and I guess before I go to this piece, I should also say that we were also able to look at current grants and think about, are there ways that we can repurpose or accelerate payments or be more flexible, given that some programs that we had already awarded funding to had to either shift or not operate. So that was another aspect of our interaction with our nonprofits through the crisis. So now we've started to move to a new phase of this work where we're really starting to look at more targeted support for expenses related to reopening, as that becomes more of a reality for many of you here in the Greater Hartford region. So what we're looking at funding is a little more targeted than the last funding round. We are looking at those expenses directly related to reopening, which could include PPE, cleaning. There could be some small capital expenditures required to accommodate social distancing in your facilities. Certainly, we expect that technology is going to become more and more critical as your staff work remotely or you provide virtual services. as well as staff health screenings. We really understand the need to keep both your staff and your clients safe as you provide the critical services to the community that you do. Of course, we are going to be expecting that all reopening plans are in alignment with state and federal public health guidelines, as we all want to make sure that we reopen safely. These will be smaller grants and for a longer time period than our last funding round. So we are expecting that these will be grants over a 6-month period. We have instituted an informal maximum of $100,000, which is really reserved for those requests that are looking at a sector-wide approach. So possibly group purchasing of PPE or cleaning supplies for an entire sector of nonprofits versus an individual nonprofit. We do expect that the average grant size will be significantly less. This is just a projection, but we're thinking around 20,000 as opposed to the close to 60,000 in the initial funding round. So when we are looking at eligibility, this also will be slightly different than our last funding round. We are looking to support a broader range of nonprofits, so not just basic human needs providers. However, we do prioritize and will continue to prioritize those organizations that are addressing critical disparities related to race, place, and income in our region, and particularly those organizations led by and serving communities and people of color in our region. So you'll see our grant making rubric, which we've put online. Obviously, there are many different criteria that go into making a decision. And they're all weighed with each other and in concert with each other. And so we've tried to be as transparent about that as possible. So our rubric is online. Feel free to take a look and you can get a sense of some of the areas that we'll be looking at, including the work in our region, alignment with the foundation's values and priorities, track record, as well as your plans for reopening. We did get lots of questions about those organizations who received a grant through the last iteration of the COVID response fund, whether they're eligible. And yes, you are eligible. You would need to wait until your last grant is expended. The award period is complete, so 3 months since the award, and your final report must be submitted. Let me pass it over to Amy.
So the award amounts, we'll be looking at several different criteria for that. The basis of that will be the assessment on the grant making rubric that Erika's already spoken about, but we will also be taking into consideration the number of staff and clients that you're serving, the size and type of facility, and the type of services that are being provided. And we will be looking at kind of all of that in combination to kind of help guide those decisions in terms of the award amount. And then for the application process, as with our first wave of COVID funding, the application is available on our website. You can download it directly there. If you click on the link, it will bring you to our online grant making system where you can use your existing login information if you have that to access. If you don't already have an account established, you can contact our grants administration staff, which is grantsadministration@hfpg.org, and they can help you set up that login account. Again, the application has been streamlined. The questions are very specific to the reopening phase. We'll be asking about your reopening plan, and we don't need to have the full large reopening plan that you probably have developed for your organization, but just a summary of that, the considerations that went into the creation of that plan, what guidance did you use in creating that, and what are the kind of critical dates that, that are involved with your reopening plan. We'll also be asking for a budget and then the amount that you're requesting from the foundation. The application will also ask how many staff you have, volunteers, number of clients, and some information about your facility. There's also a question about your cash reserve. And what we're really looking for is what are the unrestricted dollars that your organization has available at this current time. Also on the application, there'll be an opportunity to indicate any technical support that you may have, any needs that you may have within your organization at this time, and that will help inform programming through the nonprofit support program or identify any other areas where we can be of assistance. The grant requests are being reviewed weekly. The notifications are typically within 2 weeks of your application coming in, and we'll let you know whether your request has been approved or maybe on hold for some additional information or denied. The grant award letters and checks are usually received within 2 weeks of that award notification. Again, this is one of the things that we've been trying very hard to be very expedient and get the funds to you as quickly as possible. And again, the reporting requirements will remain very streamlined, and we're mostly looking at narrative reporting on what the impact of this funding has been.
So let me just say a couple of quick words about our sort of continued commitment to our basic strategic priorities. That largely is not going to change. Our focus is going to continue to be looking at pronounced disparities in our region based on race, place, and income. As many of you have probably heard by now, that is sort of our overarching strategic lens through which we view our work. But we are purposely looking at the learning that has occurred and the knowledge that we've gained as a result of the work we've done with all of you around the COVID-19 response fund and that entire experience. And I suspect over the next few months, a lot more details will be forthcoming and be made publicly about how that's going to operate going forward. As always, all of our different grant opportunities will be listed on our website, so you should certainly feel free to check there as often. I also want to quickly now then make a slight pivot and just kind of go through our strategic priorities. They are really, as you can see from the slide, grouped in 4 basic areas. But in each of those areas, there are some rather significant sort of sub categories. So the primary areas are housing opportunity neighborhoods, employment, basic human needs, civic engagement and resident engagement, and the arts. And what we've tried to do is give you a little bit of self-explanatory information about what we're looking at in each of those areas. But I want to pause for a moment, and I'll come back to some of the areas. But I want to pause for a moment to ask my colleague Dawn to say a little bit about the specifics of basic human needs, and then I'll come back and I'll say a little bit more about higher opportunity neighborhoods, employment, CIRI, and the arts. Dawn?
Thank you, Michael. I just want to let everybody know that pre-COVID, basic human needs was already infused throughout our strategic plan, providing a safety net for residents who are experiencing hunger, homelessness, domestic violence, or the lack of access to medical care. With COVID, these needs have really have been elevated, and accessing these supports are so much more critical now, more so than ever. We've learned with you through this experience and recognize, as the slide shows, that food security, shelter, health and human services, and internet access are ongoing critical needs for our residents to be able to access. Michael?
Thank you, Dawn. So just really quickly, if you look at the way we've tried to describe some of these priorities, and I'll start with higher opportunity neighborhoods, it's not that the foundation is moving away from any of its sort of traditional areas of focus, but what we've tried to do is to try to think about how we might group these priorities in ways that are sort of convenient and that make sense, I guess, intellectually in terms of how we approach them. So, for example, at the beginning of our conversation, I noted that I helped to co-lead a lot of our work around community safety. And to our thinking, when you think about things like community safety and resilience and building social cohesion in community and addressing the needs of residents or returning citizens, ultimately, we tend to think that all of that work goes very directly towards building what we think of as a higher opportunity neighborhood or higher opportunity neighborhoods. And so that's why we've decided to sort of include all of that work in what we are calling the HON strategic priority area. Similarly, if you think about if you think about employment and think about education, for example, again, it's not that we are abandoning our focus on education or on youth or on any of those kinds of activities. But we see that work as being very directly connected to questions of employment and employability. Again, all of which goes towards building a stronger community, and which even further ties back into the lens that I described earlier, the race, place, and income lens. And so, as you see from the slide, you will notice that we are focusing all of that work in the education area. Similarly, in terms of civic engagement or resident engagement, which we call CERI, the acronym, you'll see in there that we've included work that we are looking at around census, around voter participation and voter registration, around opportunity youth, et cetera, and so on and so forth. And then finally, in terms of the arts, we recognize that this is a very, very important area in terms of sort of rebuilding the vitality of our community. And so there are a number of bodies of work that we are contemplating supporting under the general sort of arts rubric. So if you look at this slide, you'll see, for example, we talk about opportunities for artists of color, different size grants to organizations in the region that focus on the arts and things of that nature. So I realize a lot of this is coming at you fairly fast, but rest assured, you'll have an opportunity to ask us as many questions as you need to when we're done. Thank you.
So we did receive 3 questions that were submitted prior to this webinar. I'm going to reiterate because I think many of the responses were covered during this presentation. But the first question we received was, if I got a COVID grant already, can I apply? And I think Erika did a fabulous job of responding. But again, I love to reiterate because my attention span sometimes can only be 60 seconds. The short response is yes. But the caveat is it has to be with 3 months since the award, and a final report has to be submitted. The narrative has to be submitted in order for you to be eligible for the reopening phase. Then the next question we had, what do you define as reopening? Some essential services have been continuing through COVID. This is okay also. We recognize that some of our nonprofit partners have been operating on a limited scale. This is an opportunity, as Erika had mentioned, to either phase in reopening other aspects of your programs, but we want to make sure that your staff and your clients are safe as you do this process. And then the last question was around the facilities questions that we asked. And the question is, we own many. How do we answer square footage questions, the lease versus own, when it is varied? If you're requesting some capital accommodations to your facility, we need to know whether you own that space or that space is being leased. We recommend that you try your best to aggregate the square footage of that space to make the necessary accommodations. But within the application, there is a narrative piece where you can fully explain what you were intending to do with the space, and then we would take that into consideration. So those were the only questions that we received prior. I welcome the Q&A to be open, and we will hopefully try to respond to all of your questions and concerns.
Thank you, Dawn. So I'm just looking at the Q&A now, and I'll start going through these and target them to my colleagues as possible, but keep throwing questions in the Q&A, and we'll answer them as long as you have them. And if we're not able to answer something today or something else comes up, know that we have our email applications@hfpg.org where you can ask questions at any time. So we got a question just asking for the definition of opportunity youth. Opportunity youth are those youth that are out of school and out of work, so not currently engaged in either system. And so that is, one cohort of many that we have targeted through our strategic grant making in the past and will continue in the future. We got a question asking, if I was turned down for a COVID grant during the initial round, can I apply with a new specific need? Yes. Yes, you absolutely can. Feel free, this is a slightly different rubric and lens. So if you were denied in the last round, take a look at the rubric and what we're looking for, and feel free to put in an application. It should be not too time consuming for you. And we'll give you feedback as we can. We got a question asking if staffing is an allowable cost, not for these grants. These are focused on the specific costs associated with reopening that we mentioned before. I don't know, Amy, if you want to add anything.
Yeah, no, I think that covers that. And do you want me to take the next question that popped up here?
Yes, please. Okay,
so the next question is, what is the status of NSP funding? And I think NSP has been, focusing on the COVID fund and the work that's related to that for the last several months. Over the course of the next 4 to 6 weeks, we will be starting to look at where else we can start to invest again. So I would say stay tuned for that, and there will be some opportunities coming up in the near future.
Great, thank you, Amy. And the next question that I see is asking whether the grant can support costs incurred prior to the grant award. So for example, PPE that was purchased in the last 6 weeks. We do have a board voted policy that we do not fund previously incurred expenses. So these would need to be projected expenses over the next 6 months. We then got a question thanking us for our transparency and asking if we would ever share the rubric scoring results of the acquiring organization. You'll see if any grant that we put on hold or is denied, we do invite you to contact us if you'd like feedback. Just because of the volume that we're getting, we're not able to put together specific feedback for every application. But if you have any questions about a decision, most likely it would be myself or Amy that you'll be talking to, and we're happy to go through the rubric and share, why we made the decision we made. So absolutely. We had applied for a non-COVID grant, which we typically are awarded annually. Does the COVID grant affect decisions for other grants? So this, I think, is almost in reference to what many nonprofits know as our 3-year rule, where you can have one grant at a time here at the Hartford Foundation. So if you, I hope I'm answering this correctly, if you currently have a grant that you either regularly got or you got prior to what we're experiencing, this is not necessarily, that doesn't necessarily mean you can't apply for the COVID funding. We may continue, just because of limited resources, to look at funding that is available to the organization writ large, whether that's through your reserves or grants that you have currently, to see what is really doable and if grant dollars can be reallocated. So for example, if you got funding for a program that you can't currently operate and it hasn't been expended, there is a chance that we may talk to you about, can you use those dollars to help during this crisis? I hope that answered that question. Does anyone else on our panel have a better response? No. Okay, great. My organization reopened in June, but we continue to face ongoing increased expenses to ensure staff and customer safety. Can we apply for these new expenses for the 6-month time frame? So when you apply, you would be projecting your expenses for the upcoming 6-month period. I'm going to let Amy take this next question that you see from Megan.
Sure. So the question is about cash reserves and whether you should include funds that we have in our endowment, even if those funds are restricted via board policy and cannot be used. So I would say for this one, we'll look at kind of the traditional restriction, which means that the donor would have had to restrict that. If the board has control of those funds and can make a decision whether or not to use those should be included in that reserve figure. But again, if a donor has restricted that and it's truly sitting in an endowment that a donor has restricted, you would not need to include that. So it's, again, anything that the organization, board or staff has the ability to control the use of those funds and what they will be put towards.
Great, thank you, Amy. And we got a question about the report form for the initial COVID grant. We do have an online application system, and all of your application and reporting now goes through that system, which we're really happy about. So if you log in, you should see the availability of the final report, and it'll give you a date at which you can submit it, 3 months from the time of the award. That is a soft deadline. So if you don't get it in for 4 or 5 months, beyond the grant award, that's fine. If you're for some reason not able to access the report form on your grant portal, please just let us know through the applications@hfpg.org email address. So the next question provides some clarification on the staffing question, asking if COVID deep cleaning done by a part-time staff person, so extra costs for that staffing to do cleaning for reopening, would be eligible. And yes, I think we would be open if you're in fact having to pay staff to do additional work to reopen safely. Can the grant be used for a consultant to help craft policies and procedures? That's a great question. Amy, do you have any thoughts on this?
I mean, I guess I think that that would be an appropriate use and something that we could definitely consider through the grant. I would just make sure that, you know, from a cost perspective, that that's not going to be the majority of the request, because we're really looking to fund the hard costs that would come out of a plan like that. But I would say that you could definitely include it in the budget, and it's something that we could consider.
Yeah.
I would also quickly add that if you're talking about policies and procedures that ultimately allow you as an organization to better serve your clientele or better serve whatever your overall body of work is, that's certainly a compelling thing to raise, and I think it's something that we would certainly be willing to look at. So.
Yeah, and we recognize that there's a really broad range of nonprofits on this webinar and that are going to be applying for this funding. And so you all have, in many cases, very unique services that you're providing. And some have very clear guidance that has been provided by the state or other entities, and some may be less clear. So I would say, you know, we're willing to learn with you what the needs are to reopen safely. And if there's something that you think would meaningfully help you do that, you can make the case in the application. Yep.
Yeah, I was just going to reiterate, responding to the technical assistance question within the application is really critical. It helps us gauge future needs of nonprofits as we go through the next 6 months in terms of what supports you all will need to address or readdress the current environment going forward.
Great, thank you. And panelists, keep jumping in as we try to get to these efficiently. So the next question is asking if the grant can be applied to the cost of reopening as well as remote operation costs. And just talking about the unknowns in offering services and preparing for both scenarios. And I see all of our panelists head shaking. Yes, yes. So we're asking for your plans as of this point in time. And we really, really recognize that things may change, even, you know, a couple of weeks after a grant is awarded. So we are asking you to project what line items you think you may need, and there will be flexibility in adjusting among those line items if you are awarded a grant, if the situation changes over the next 6 months. But again, we'll just ask you at the end of the reporting period, not necessarily for a line item budget of how you spent the money, but we would want to know in general what scenario you did pursue and why, and how our dollars were able to support you. Okay, sorry, I'm jumping around here. I think someone's deleting questions, so it jumps for me. Would the grant be able to be used to cover the costs of improving ventilation systems? Amy, do you want to jump in on this one?
Yeah, I think what we were hoping to do with this particular round of funding is modest and small capital improvements. So I'm not sure exactly what the cost would be for the ventilation system. And I would say if it's some minor tweaks to what you have, then possibly that could be an appropriate use of the funds. If that's a large ticket item and a complete revamp of the ventilation system, that would probably be outside of the scope of what we could fund within this. But again, you know, we can have a one-on-one conversation about that and tell us what you're thinking through the application process, and we can look at that.
Thank you. So we have a question here, a little bit different. An organization that works with people that are homebound without transportation due to COVID-19 and wants to start emphasizing the importance of voting and asked about our strategic priority in Get Out the Vote. And so I'll just say, and I know Dawn is on our community resident engagement team, but we had an RFP several weeks ago now for Get Out the Vote efforts. Dawn, do you want to maybe speak to that? But I do think it's closed at this point, correct?
Yes, the grants have been awarded. I don't believe a public announcement has been made, but one of the grantees is addressing the transportation issue, specifically in Hartford. While it may not cover the entire breadth and need of transportation, there is support for this activity as you've laid out.
Thanks, Dawn. And feel free to, we did put our email addresses on this slide as well. So if there's any one of us that maybe has a particular expertise in an area and we're not adequately answering your question, feel free to shoot us a follow-up email. We're happy to hop on the phone or try and provide additional clarity to your unique situation. There's one last question here asking, what if we are a statewide organization with some services in Hartford? We do continue to accept requests from statewide organizations with significant services in Hartford. Obviously, any funding that would be awarded by the Hartford Foundation as the community foundation for the greater Hartford region would need to be targeted to reopening services in our region. So statewide organizations are eligible to apply. You will see on our rubric, though, that the more concentration of services that you have in our region, obviously the higher it is as far as our priorities for funding. And I would just say, having read applications for the last COVID grant, if you are a statewide organization, make it very, very clear in your application the services that you provide in our funding region and how specifically our dollars would be targeted to help reopen services in our funding region. Okay, so I think we have answered all of the questions that are currently in the chat box. And so we will, I think, close out the webinar. If there are no further questions, as we mentioned, we've recorded this. It will be emailed to you along with the slides, and we will post it on our website. So if you think there are other nonprofits that would benefit from this information, please feel free to forward and direct them either to the webinar or to us. So with that, I think we just want to, again, thank all of you in the nonprofit community for the work that you are doing. We just are in awe of all of you and just continue to be honored to support you in any way that we can, given the critical work that you do. So feel free to reach out to any of us if there's anything that we can do to be helpful. All right, so thank you, panelists.